So just hang tight for a minute while it's setting up the stream.
I'm sorry. There's a festival going on behind me. I don't think I can do anything about it.
That's okay. Thank you everybody for joining us this evening. This is our second live Q&A event. We're streaming across multiple social media platforms. We are joined this evening by plastic surgeon, Dr. Kaitlyn Paine, as well as bariatric surgeon, Dr. Elizabeth Godshall. So thank you everybody for joining us, and we're gonna go ahead and get started. So without further ado, if you'd like to do some quick introductions, we'll start with you, Dr. Paine.
Sure. So hello, my name is Dr. Paine. I am a plastic surgeon that specializes in body contouring procedures after weight loss, as well as just general plastic surgery. I trained at Mount Sinai Hospital in New York, and since then I've been working with the New York Bariatric group, helping their patients after their weight loss.
And go ahead, Dr. Godshall.
I'm Dr. Godshall. I am a general and bariatric surgeon here with the New York Bariatric Group. I trained both in Charleston, South Carolina, and did a fellowship in Pittsburgh, specializing in bariatrics. And I've been with the group for going on about 4 years, and I'm based in our Westchester and New York City locations.
Fantastic. So let's go ahead and get started. Dr. Godshall, will you go ahead and ask Dr. Paine some of the most common questions that come up regarding plastics?
Of course. One of the, very common questions that patients bring to my office, even at the time of some of our initial discussions about bariatric surgery, is what happens after they get through the process, after they've lost all of their weight, regarding excess skin, and what sort of approaches you might have and options you might have for treating.
Yeah, definitely. So I would say that areas that many patients experience excess skin in after bariatric surgery tend to be sort of 4 main areas. One is sort of the abdominal and sometimes back area. The second can be in the arms. Third, in the chest area, both for men and women. And then fourth is commonly the thigh area. All of those areas, there are procedures to help address concerns for excess skin. Typically, I see patients when they are a year to 18 months after their bariatric procedure, just because many insurances require that patients be a year out or be 18 months out, and ideally have their weight be stable for about 6 months before undergoing a body contouring procedure after bariatric surgery. For you, Dr. Godshall, to follow up, I would say, I'm curious about this too. In terms of, if you're somebody who is interested in undergoing bariatric surgery, how do you best make the choice of which bariatric surgery or what weight loss option should you go for, in terms of even just what options are available for people?
Sure. No, that's a really good question. Unfortunately, it's not something that has a single or really straightforward answer for, or a similar answer for all patients. It's very much one of those questions that is sort of a decision that we come to based on maybe some recommendations I might have about procedures, but also it's very much based on a particular patient and what might be best suited to them. I would say there are probably 2 most common surgical procedures we offer. The most commonly performed is something called the sleeve gastrectomy. The second most common procedure we perform is the gastric bypass. We do have other surgical options as well as some revisional options, certainly. But, I'd say generally speaking, it comes down to sort of the weight a patient may have to lose. We incorporate, information about a patient's personal history. There might be certain medical conditions that are favored with one procedure versus another. But frankly, it also takes into consideration a patient's weighing of risks and benefits. There are certain procedures that have maybe greater risks than others, and certain risks that a patient that may not be palatable to a certain patient. So, our job is really not to force anything on one particular person, but to really take everything into consideration to hopefully give a patient a very successful weight loss, but also in a safe and sort of manageable way.
Mm.
I think you in answering your previous question, gave some helpful information about some points I was going to ask about. So, certainly what areas can be addressed in terms of surgical options is really important. So you mentioned, I think, kind of 4 general areas. Are those things that can be addressed at the same time? Can they be addressed in a singular surgical event, or are those things that you might have to stage for any one particular person?
So I would say that unfortunately, I can't do all 4 areas at the same time. That is a constraint that I have. The reason why sometimes I have to limit the number of areas that I work on is mostly due to safety concerns. Ideally, you want to keep procedures to be 6 hours or less in the operating room, because when you start going longer than that, it does increase your risk of having like a little infection or maybe having some difficulty healing all the incision, basically. Ideally, how I kind of like to break it up is I would do sort of 3 areas. The first area that I often start with is the abdominal and the back area. And one of the more common procedures I start off with many patients who have lost a lot of weight is something called a lower body lift, which not only addresses the excess skin in the front and does basically what we often think of as like a tummy tuck type procedure, where you're removing that excess skin that's hanging down over the front of the stomach. It also helps to lift the outer thighs and can lift the buttocks at the same time, because sometimes that area can also get a little bit droopy. So that I can combine all together as one procedure. I'll oftentimes combine the arm and the chest area all together as one procedure. Once in a while, if a patient does want an implant, sometimes I do have to stage just that implant part of the procedure, just to make sure that everything's very sterile. Because if I'm working in the axillary area, sometimes I don't always want to put a nice clean implant in at the same time. And then the last area is the thigh area, which I tend to do by itself. So can combine some, but unfortunately can't do all of them. I wish I could. But that would be a lot to heal from, I would say. But to follow up with your question, it sounds like the decision making is very complicated, and personalized when you're trying to decide what type of procedure to choose. Is there any one procedure that's sort of considered the safest or the best in terms of long-term weight loss?
I think the word you used a minute ago, personalized, is really kind of the important takeaway. It is very much an individualized discussion about what might be the best for any one patient. Mm-hmm. At this point in time, the sleeve gastrectomy has really kind of taken an important role in the field as, a procedure that can offer similar degrees of weight loss for most patients, to that of the gastric bypass, which historically has been somewhat of a gold standard in the field as far as weight loss. But for many of our patients, it can minimize some of the risks and some of the complications that have also been sort of described and seen historically with the gastric bypass. So to some degree, it becomes a procedure that has a similar benefit and less risk. So for many of our patients, I think it can really be one of the safest options available. Like I highlighted a minute ago, there might be certain medical conditions that a patient has that might make, for instance, the gastric bypass still the better option in that setting. A really sort of good example of that might be somebody that has really bad reflux with precancerous changes of the lower esophagus. That can be a setting in which, as a provider, I might recommend a bypass as a safer option. So it's not to suggest that the gastric bypass is a wrong option or frankly, even a bad option. Both are really effective, but in any one particular patient, it's really a matter of weighing kind of the risks and benefits. But I think generally speaking, the sleeve gastrectomy has really taken an important role in the field. So I think a minute ago, you had kind of alluded to sort of insurance companies in terms of what you might be looking for in terms of either timing or criteria that had mentioned that, as far as plastic surgery options. Are the options that you've sort of mentioned typically covered by insurance or in part or even on the whole?
Yeah. So insurance often will cover skin removal in instances of massive weight loss patients. It can be a little individualized between each insurance plan, and there's never any guarantee that an insurance plan, unfortunately, would cover a procedure. I wish I could get a guarantee from insurance companies. But I think that the best thing for patients to do to create a really robust package when they're considering applying for these procedures is documenting things. Insurance companies often look at things such as irritation or rashes that patients are having. So if patients take pictures of those or seek treatment for those things, those are really nice things that they're able to document. So when they are interested in getting procedures done, we can send that to the insurance company. Also things like back pain, neck pain, or discomfort in the joints from having that additional skin. If they're getting treatments for that or take medications for that, that's another really nice thing to kind of document that's going on. So when a patient comes to see me, I'll often ask them, have they been in treatment for any of these things? If they have, what providers have been doing it, and if we can get letters or if they have photographs of those things. And that's a little package that I make for the insurance company, along with images that I take during their visit to try to demonstrate why I think that the procedure is a reconstructive procedure. Insurance companies don't always cover things like liposuction or fat transfer. Sometimes patients, when I do liposuction, want the fat placed someplace else, like in the buttocks, in the chest, in the face. Those things are sort of extras that can be done at the same time, but are not generally covered by the insurance company. Yeah. Continuing on, I'm curious, how much time do patients generally take off for bariatric surgery in terms of work and then like getting back to the gym?
That's a pretty common question, in terms of overall recovery, how much time to plan for, time off of work, assistance that might be needed at home, things of that nature. In general, most of our surgical procedures are performed laparoscopically, so through small incisions, which has really helped to help people recover more quickly in terms of time back on their feet and overall sort of time away from their typical activities. As far as pain control, most people will have some degree of pain postoperatively just because of said incisions. But most patients take a few doses, if not a few days of pain medication, and are able to transition to things like Tylenol and even Gas-X fairly quickly. Early mobility is a really important part of our postoperative recovery period. So in terms of helping you recover quickly and safely, we do have you up and on your feet very quickly. So walking around the hospital, even right after you wake up from anesthesia, is a very commonplace practice, which helps keep you safe in terms of minimizing things like pneumonias or blood clots, but also helps to alleviate some of that pain, particularly gas pain, very quickly. So this is not a recovery period in which patients are expected to be bedbound or laid up for any period of time. We expect you to be on your feet, moving around. Pain again kind of tends to dissipate fairly quickly. By about a week or so, most people feel much more like their normal selves. So I would say on average, sort of all comers, people take about a week or so after off of surgery, off of their, typical work or school schedule before returning. When they do return, I do ask that they don't do any heavy lifting. So that's any more than about 10 to 15 pounds for the first month after surgery. So that can be a consideration for some, only because people may have certain jobs where they can't return light duty or they don't have that capability. So there are situations in which case I might ask a patient to be out for a full month just to protect the healing of their incisions. But during that time, again, they should still be up and about. You can be driving as soon as you're off of your pain medications. It really is more of sort of a lifting consideration. And as far as gym return, even though we ask that you don't, patients don't do anything too strenuous, we still want you to be moving. So, using a treadmill, a light jog, even a light elliptical or a bike, those can all be good options in the first month. And then once those restrictions are lifted after that first month visit, we can typically have patients sort of resuming their typical gym or sort of activity level, which will include, more strenuous activity or weights as well. In terms of plastic surgery, same kind of question for you. So what does the recovery period look like after maybe some of the more common options? Do you have any of the similar type of restrictions as far as activity or any different time frame that patients could expect?
It's actually very similar. Although I would say the timeframes are slightly longer. I'm jealous of your incisions that are like 1 inch, 2 inches. Unfortunately, that's sort of the balance of plastic surgery is we can make things very tight and smooth, but the price of that is a longer incision. So generally for us, very similar. I think that's always good for patients to walk after surgery. It helps decrease the risk of getting blood clots, helps people breathe, helps alleviate some of the gas pain that patients can have after surgery. Because many of the medications that patients get when they're asleep for surgery can make you a little constipated. I do often also start my patients on a stool softener, generally a day or two before surgery, just to help prevent them from feeling constipated afterwards. Because surprisingly, sometimes I think that can cause a lot of discomfort that's unnecessary. In addition to that, I do give my patients a longer acting numbing medication to help keep them more comfortable when they wake up from surgery while they're asleep. And then I send them home with several different pain medications because I'm a big believer in multimodal pain control. So typically my patients will go home on Tylenol and gabapentin. Oftentimes I'll give like a muscle relaxant because when you're sleeping in different ways, because you have incisions that you're trying to heal, sometimes that can make you have some muscle cramps or things like that, which can really help. And then I also do give my patients a little bit of a stronger pain medication in case they have difficulty sleeping at night or something of that nature. Oftentimes, most of my patients are off a stronger pain medication within the first 2 to 4 days. And generally, they are no longer taking any pain medications after the first week, and definitely by after the first 2 weeks, I expect them to be off of everything. In terms of going back to work, I generally recommend taking 2 to 3 weeks off of work to go back to a desk job. Oftentimes by that point in time, if you did have a drain to help remove fluid, the drains would all be removed. You can go back to work with a drain, but many people don't want to. So I like being able to remove them before they go back to their jobs, just so they can feel like they move around more easily and there's not something kind of there that's bothering them while they work. And at 3 weeks, I say that they can go back to kind of a little bit more physical activities, like you said, walking on the treadmill, using a bike with no like added weight or pressure on it. You should walk after surgery, same as yours. Generally, I say something like 100 steps a day, little things to the bathroom, around the house, stuff like that. And I generally recommend doing 6 weeks to get back to your full lifting routine. Just because with longer incisions, you want to make it takes about that length of time for the incisions to become strong, so that, you know, when you're doing things like lifting up heavy stuff, you're not worried about the incision having any problem with healing. So that's generally my recommendations. Oftentimes my patients do wear some compression garments just to help with any kind of post-operative swelling. And then also I think it helps improve their comfort too after the surgery. Yeah. Another question. How often do your patients come into clinic after surgery to see you?
As a practice, generally, we have a very sort of intensive follow-up schedule, much more so than I encountered even during training or otherwise. And part of the reason for that is to help and track your weight loss progress, but also to monitor for any issues along the way. And we use each visit after surgery to really incorporate a lot of guidance to help people, advance their diet, advance their activity. So I think it can help people navigate sort of the recovery process and also the process of losing weight a little bit more successfully. So our first visit after surgery is typically a week or so after the procedure itself. That kind of correlates, like we just mentioned, with return to work. So we're kind of having an initial check-in before patients are kind of making the decision on whether they're ready to get back to at least some degree of light work responsibility. And then over the course of the first year, we're actually seeing patients once per month. So again, it can be fairly intensive at this point in time. With COVID, under our belts, we are very comfortable doing virtual visits as well, in addition to in-person. So it helps us really stay on top of some of the big adjustments patients are going through in terms of progressing their diet and sort of resuming normal activities as well. And part of the significance of following that closely for the first year is that it typically does take most people an entire year, if not in some cases 18 months, to lose the majority of their expected weight. And not just that, also stabilize their weight. So we want sort of a stable plateau, once they've kind of been through the process. So I know with bariatric surgery, there are fairly standardized criteria that patients have to meet in terms of being approved from an insurance perspective. Sort of in general, patients have to meet a certain BMI criteria, minimum being 35. Anybody over a BMI of 40 is sort of approved by that BMI alone. But when they're in a certain range, 35 to 40, they're also required to have certain other health conditions such as sleep apnea or diabetes. Do you have any certain criteria that might apply in terms of those procedures that do get approved by insurance when you're moving forward from a plastic standpoint?
Yeah. So in terms of doing body contouring procedures, I would say that it's all based on patient safety and optimizing everything so that the patient has the best operative experience they can have. They have no complications, no issues with healing. And you really want to set every patient up with that being the goal in mind. So that being said, in terms of the general surgery literature, people who do have BMIs of 30 or more are at slightly increased risk of wound healing complications, such as part of the incision opening up a little bit, needing extra dressings, creams, lotions to help it heal, or getting an infection that might need, an extra dose of antibiotics or things like that to help clear up. So in cases like that, I don't often use 30 as a strict standard, because I know that especially for patients who have lost, over 100 pounds or a lot of weight, that can be a very challenging goal to meet, especially given that a lot of times they can have a lot of excess skin also getting in their way of exercising and moving around. So I often try to get patients as close to 30 as they can be if they are not at 30 or below. But I do think that 31, 32, 33 are all kind of acceptable numbers, as long as they have stabilized their weight and at least attempted to try to get down to 30 or as close as possible. When patients kind of have BMIs that go higher than that, then that's a little bit more of a talking point, and I really do encourage them to try to bring their weight down to reduce their risk factors. In terms of other criteria, the biggest things is just to make sure that any medical problems that you do have are very well controlled, things like diabetes or high blood pressure, and then also that you don't have any contraindications for being under anesthesia. Sometimes plastic surgery cases can take a little bit longer than bariatric cases. Because it's a little bit more to suture and close. So, you know, you want to make sure that that you are, you know, healthy enough that, you know, going for maybe a 3 or 4 hour procedure is something that can be well tolerated. I would say for the majority of people, though, as long as they're optimized, they've seen their specialists and everything's set up well, then they're a good candidate for plastic surgery. The only other thing that tends to be very important is to not be smoking anything. No cigarettes, no e-vapes, no marijuana, nothing. And generally I like it 6 weeks before and 6 weeks or until you're fully healed after, because smoking can just be very detrimental to wound healing. But those are my 2 big ones. Everything else generally we can optimize.
Can work with, yeah.
Yeah, exactly. Let's see. So I mean, I see most of your successes in clinic, so it's great. But if a patient is finding that they're regaining a little bit of weight after their gastric bypass or after their bariatric surgery, what options do they have if they feel like they're struggling with weight regain?
So we have a couple ways, I would say, to approach regain. Part of the reason that we do have such a frequent follow-up schedule, not just in the first year, but really long term, you know, we'll see a patient as long as they care to keep coming to see us, frankly speaking. So I think having a little bit of an open door policy, you know, enables people to also come back before, you know, they've regained, you know, a significant amount. So we have plenty of patients who might see the scale maybe moving in the wrong direction. You know, could be any number of reasons, COVID, you know, significant life event, personally speaking, you know, medication that has a side effect of weight gain. So it can be any number of reasons. But, you know, if patients are looking for potentially a more modest weight loss, we can offer something called medically supervised weight loss, which is refocusing from a nutritional standpoint, as well as offering potential use of certain weight loss medications as well, kind of depending on certain medical history and the degree of loss that a patient might be interested in. And it's a way for some patients to address weight in a very supportive environment, you know, with reinforcement and structure. But for some people, it also can avoid a surgery, which, you know, they've already been through, you know, a very significant surgical procedure and in many cases lost significant amounts of weight. So most are looking to not necessarily have to go through such an extensive process again. That being said, we certainly also see patients, our own, but also those from other practices who have regained a significant enough amount of weight that they do in fact meet criteria to consider other surgical options. And so for patients that have had any number of previous surgeries, both a sleeve gastrectomy or gastric bypass, to name a few, we do offer a number of revisional options. And typically speaking, they are subject to similar criteria that you would be subject to for an initial surgical option. And we would request that patients go through a very similar workup process, which for our practice includes seeing people like a cardiologist and a pulmonologist. We also have you see a nutritionist and a psychologist, and also perform an endoscopy pre-surgery, and all of those things to help facilitate the process, regardless of whether it's in the setting of revision or in the setting of a first-time surgery. We can often provide in one day to help expedite the workup and expedite the process. So I think the bottom line take home is it's never really something I would consider a failure, and it's never something I consider or I would ever want a patient to feel embarrassed about if they do have weight regain, because there are lots of reasons that that can happen. It's not just something we ever want somebody to blame themselves for. I overate, or I just stop being active. That can be part of it, but it's not just a single reason that patients have extra weight on their frames. And it's the multitude of reasons for any one particular person that's made it so hard to treat in the long term. So, if anyone's ever concerned about having regained weight after an initial procedure, we encourage you to come in. We want to see you because that's when we can help. So I know we've talked about a number of surgical options that you offer. Do you, as a provider, also offer non-surgical options or less invasive plastic surgery procedures?
Yes. So additional sort of less invasive procedures that we do offer is if someone does have a little bit of extra adiposity or fullness in certain areas, I can offer something like cool sculpting, which is basically a process that cools the fat cells through the application of a sort of a cooling device on the skin itself. And those fat cells actually freeze, die, and your body removes them. That's something that can be done. There's no cuts or incisions. Generally takes an afternoon, depending on how many areas we're going to treat at that point in time, and can help kind of decrease some of the fullness in an area where you may notice some additional adiposity. In terms of other treatments that are non-invasive, a lot of times there are some facial treatments that we can do to try to fill some of the volume that's lost in the face, especially with a lot of weight loss. Sometimes people can notice that they've also lost some volume in areas in their face. So things like fillers sometimes can help improve some of the volume deficiencies that people have as something that is non-surgical. In terms of, though, if people have a lot of excess skin, I would still say that removal of that excess skin is sort of the most definitive way to handle that at this point in time. Yeah. In terms of, let's see. I feel like you answered two of these questions in one. But let me just say, this one's very straightforward. Is bariatric surgery safe?
So I think anything that we perform, surgically speaking, has risk. There's no way to completely eliminate risk. So any procedure is going to have some, for instance, mortality rate, or some risk to it. Even placing something like an IV or giving an immunization, those are fairly low in terms of invasiveness, but certainly have their own risks, even if it's something such as discomfort. Overall, in terms of mortality rates, mortality for the procedures that we've discussed are very, very low. A sleeve gastrectomy has a mortality rate of 0.1% currently. Gastric bypass is about 0.5%. So these are overall incredibly safe procedures in terms of a patient being able to successfully move through them. And we help to hopefully minimize any additional risk of other potential side effects or complications with such an extensive workup that we do, prior, and also how closely we follow a patient post-surgery. So, and I think in terms of giving that question a little bit of context, we talk about, safety in terms of things like survival. When you look at risk of procedures, or risk of mortality for complications of not doing surgery, it's actually higher. So the mortality rate for morbidly obese patients that do not undergo surgery is actually higher than the mortality rate for morbidly obese patients that go through surgery and subsequently lose their weight. Part of the reason for that is that it's not without risk to be morbidly obese and to not do anything, because there's still a very significant risk of developing other weight-related issues, things like diabetes, things like high blood pressure, things like sleep apnea. All of those have their own complications as well. And many patients, if they're not treating their weight and helping to reduce the likelihood of those conditions, actually end up succumbing to the sequela of those diseases. So technically speaking, undergoing surgery is actually safer than not doing anything.
Mm. Makes sense.
Thank you both. That was very insightful and very informative. There are some questions that are being posed on the different platforms. So I would love for the both of you, if you can view it in the chat, to answer those questions. So maybe you can let me know if you can see them in the chat.
Okay. I don't know, do you want to go through these one at a time, Dr. Paine, or start at the top
can.
maybe?
Yeah.
I think the
love
first
it.
one's for you.
Yeah. Facebook question. How would someone go about getting skin removal covered by insurance? So what I would say is, I think that building sort of your case and your documentation of your symptoms that the skin is causing is really important in this. So oftentimes when a patient comes to see me, I'll ask them about their history of rashes. I'll ask them about their history of neck, back, shoulder, joint pain. And I'll ask them if there's any other additional symptoms that, I just haven't thought of or don't know about. Sometimes people have difficulty balancing because of the excess skin. Sometimes people feel like they have to take many showers a day because of their excess skin. Just lots of different things. And so if you're someone who is having excess skin, I would say that if you're having symptoms, don't tough it out, like seek treatment, talk to your primary care doctor, talk to a dermatologist, talk to people about it, try treatments. So that way, when you see me, we can kind of send to the insurance company all the things that you've tried. So the insurance company understands that you did try conservative management, and that is not doing enough to fix the symptoms that the excess skin is causing, and that, the next step to consider would possibly be surgical removal of the excess skin. If you see me and I see that maybe you would benefit from maybe like attempting like an antifungal powder, or maybe attempting physical therapy. Sometimes that's something that I do send people to, or I suggest to try for 3 months before submitting to insurance, just so that we can have a little bit of a stronger case. And then also if you get any rashes or have anything that you can kind of document during that time, to also collect it, so that when you see me again in 3 months, we just have a little bit of a stronger package to send to the insurance company. But really most of the conversations, what we do in office, your history of these treatments, the images, that's what we send.
Just to piggyback off of that, for patients that are going through the bariatric surgery process with us, we use the same medical record system that Dr. Paine does. So at each of our follow-up visits, as you're losing, issues like that may come up. So whether it be rashes and skin folds, and so we can actually be helping to almost build your case as you're going through the loss process, and we will prescribe nystatin as you're going to help with a rash you may have in a certain crease, and kind of build some of that documentation. So use those post-operative visits with us in some ways almost in anticipation as well of areas that you may want to move from a plastic surgery standpoint.
Yeah, exactly. And I tell patients too, sometimes like after, like when we're getting ready for the first surgery, I'm like, you can use the nystatin powder in other areas. You can start documenting and getting things ready, you know?
Yep.
So it's good. Is the next one, I think the next one's for
More
you,
for
right?
me, yeah. So the next question from Facebook is, what is the normal weight loss average after gastric bypass after 3 months? I never like to give sort of a certain weight loss sort of expectation early on in the process. Really, we project a certain degree of loss, but for many patients, they can move at different speeds. And part of the reason that we have as frequent of a schedule in terms of follow-up is to help you move and sort of be as successful as possible. But, you know, in terms of that loss, it may be a little bit up and down. We're looking at a trend, not a certain number. So we're using small adjustments along the way to hopefully get people as low as possible. In general, the first few months after surgery tend to be some of the most significant in terms of loss. Part of that relates to the fact that you're starting at your highest weight, but also that our diet is some of the most restrictive at that point. In sort of the middle of the loss process, I'd say generally people will start to lose somewhere in the 7 to 10 pounds a month range. However, the lower you get, the slower your loss is going to progress. So it's really sort of a curve overall that we're looking for. And I never want people on the scale every day. Really, this is more of a trend, and you should be, you know, judging your loss based on sort of your appearance, based on size of clothing. And we'll measure you at each of your post-op visits to sort of keep track of your weight loss. But it's, you know, you're still human as you're losing as well. So it's possible to weigh more the next day than you did the day before. It's really, again, about the trend, and our goal is to get you as low as possible, as safely as possible.
Sense. So I believe the next one is me. Is there a recommended way to get your collagen in, liquid versus powder, chewy, etc.? So collagen supplementation is a really interesting thing. I would say right now, in terms of like strong scientific research, there isn't like a strong case where I feel like there's enough evidence for me to really promote collagen for my patients. You know, I try to think about what and the idea behind collagen supplementation is basically that if you are taking in additional collagen, that will help improve the amount of collagen in your skin, help somewhat with the aging process or sort of skin laxity that you can develop. So while I'd say there's a couple studies kind of softly showing that collagen may improve, there isn't sort of good definitive studies comparing different types of collagen supplementation where I could say one is necessarily better than the other. And I even think that the recommendation that people should take collagen is a little bit of a soft recommendation, just because I think there would need to be more evidence for it to be something that I would strongly recommend for every patient to believe that they got a major benefit from collagen supplementation, and it's something that they should be spending their money on, given that there's a lot of things that you could recommend to people that may help or may work. But if I'm going to give a recommendation to patients, I want to make sure that I have a very strong recommendation that I think it's going to make a significant difference in their life, if they're going to spend, you know, additional income on something. So while I think collagen is not hurtful, at this point, I don't feel strongly that it's helpful. And I definitely don't think that there's enough studies out there for me to say definitively one form is superior than the other form. I wish I did. I wish it was clear.
So I think the next one is on my end. First question is typical recovery time after a gastric sleeve procedure. The surgery itself typically takes about 30 to 40 minutes. You spend one night in the hospital. And as we discussed a little bit earlier, I generally expect about a week out of work or your typical school or life routine. I do have lifting restrictions in place for 1 month total. So no strenuous activity or lifting anything more than 10 to 15 pounds for the first month. That does not preclude light exercise, light activity. But in general, healing is healing. So Dr. Paine mentioned that she expects, full strength of her incisions at 6 weeks. I would say the same. Even though we let you get back to work and, resume many of your normal activities, your body is healing and it's effectively running a marathon for, 6 weeks as it's shunting a lot of your extra energy and calories towards healing. So, I also think you need to, keep in mind that, while many patients after weight loss surgery start losing quickly, that may help to promote energy levels. But it also is okay if you're tired after surgery or if your energy and stamina aren't 100%, because your body for 6 weeks or so is still working hard to recover, even though you may have resumed sort of normal activities. So we give you certain limitations so that we know you're safe to be resuming activities, but you're healing a lot longer than we're restricting you. The next question I think is probably for me as well, asking about if surgery is possible with severe sleep apnea. Sleep apnea is a very common diagnosis in patients that are morbidly obese, and that category really correlates to people that have a BMI of 35 or higher. It's something that we actively seek to diagnose. So even if a patient doesn't carry that diagnosis at our first visit, we do test everyone for the presence of sleep apnea, because having it, and if it's present, treating it, helps to minimize heart and lung complications around the anesthetic event. So we are motivated for your safety to identify and treat those types of issues ahead of time. So it's, the presence of it isn't meant to exclude or prohibit surgery. As with much of our pre-surgery workup, our goal is to really just keep you as safe as possible. I don't want any surprises. If something is present and there, let's address it and deal with it to help and make surgery a safer event for you. Nothing that we're testing for is meant to exclude you or rule you out for surgery.
Yeah, I agree. Next question. If you need all of the different types of skin removal, how long to do the for? And I'm assuming how long do the surgeries take? So I can do the next surgery within generally 3 months apart. So generally, if I, let's say, work on the abdominal area, then 3 to 4 months later, I could perform surgery on the arm or the chest area. Most of my surgeries, it's very individualized how long a surgery would take, because some people, may only need skin removal of the front part of the abdomen. Some people may want or need skin removal on the front and the back part of the abdomen and then the back. And obviously that is going to take longer if I'm removing skin circumferentially around. So I would say most plastic surgery procedures in terms of body contouring take somewhere between 3 to 6 hours. Once again, I like to try to keep things 6 hours or below, just to reduce the risk of complications. Once in a while, it can get closer to 7, but that's in cases if I'm doing a lot of liposuction and then fat grafting at the same time. And I do that because I can't separate it out at that point in time. If I'm doing the liposuction and I have the fat, I can't like freeze the fat and come back later. I gotta put it where people want it at that point in time. So I'd say, yeah, expect most of the surgeries to take somewhere between 3 to 6 hours. If you're closer to the 6-hour mark, oftentimes I do recommend a night stay in the hospital, and then you would go home the next day. And then the surgeries can be done as soon as 3 months apart for the different body parts.
Next question. Do you guys do anything with COVID after people being stuck at home and either gaining or regaining weight during that time period? What I would say is we have seen a number of patients interested in different options, whether it be bariatric surgery, I'm sure plastic surgery as well, post-COVID or in the midst of COVID. However, criteria on my end doesn't change. So a patient still is going to be subject to the same criteria. as far as being approved for different surgical options. It, does not necessarily mean if they don't meet criteria that they also can't consider different non-surgical options, which could mean medical weight loss, as I discussed briefly, or things like gastric balloons as well. So we have a number of different options from a weight loss standpoint to assist.
Yeah, I agree. Next one probably could go to either one of us, but I'll answer because this is something that sometimes does happen. Is it normal to have fluid retention after surgery? So, especially in procedures where we're doing liposuction, doing a lot of skin remodeling or removal, and placing, fat in other areas of the body. We often use the term like fluid shifts, but basically your body's natural reaction to any kind of insult or injury, such as liposuction or a surgical incision, is to swell. So I often tell patients not to judge themselves by how they look the day after surgery, because they're going to be very swollen. In addition to that, when I do liposuction, I actually do put a little bit of fluid into the body because it helps me remove the fat, and it also helps decrease bleeding. So many of my patients are very swollen the day after surgery. That's one of the reasons why I do recommend wearing the compression garment to help decrease some of that surgical swelling. And then also, I do use oftentimes drains to help the body remove fluid more easily as well. Sometimes patients if patients still have a lot of swelling, oftentimes, honestly, people pee it out after the first 2 or 3 days of surgery. Definitely by the end of the first 2 weeks, I expect the majority of that fluid to have been removed from your body. Once in a while, people still may notice that they still have a little bit of extra fluid after the 2-week mark. Sometimes I do start a medication to help them more easily remove the fluid, basically pee it out again, if they need it. And then you do have to remember, when we're remodeling large areas of the skin, we're disrupting things like the veins, or we're disrupting the lymphatic systems. And those are the systems in our body that help our body remove fluid. And it can take time for your body to regrow and remake those connections. And that's why things like wearing a compression garment for 6 weeks after surgery is really helpful, because it gives your body time to help regrow those connections. And even sometimes several months out from surgery, patients will still notice maybe a little bit of minor swelling in certain areas. Like after a long day, they may say, "Oh, I still notice a little bit of swelling at the bottom part of my stomach." That is something that definitely generally goes away by 6 months to a year after surgery. And at that point, it is much more subtle. It's just something that a patient would notice, not something that other people on the street would necessarily notice or point out. And it's just because it takes that extra time for your body to recreate the lymphatics, recreate those venous connections to help your body more naturally remove fluid. So long story short, first 2 or 3 days is sort of the worst of the swelling. Definitely by the end of the first 2 weeks, I expect the majority of the swelling to all be gone. And then, 3 to 6 months out, I expect basically for you not really to have too many feelings of feeling like swollen by the end of the day, or anything else like that, because hopefully at that point, your body has recreated its lymphatic and venous systems.
So I think we're getting close to the end on time. There were, I think, maybe 2 more questions on my end that I can answer pretty quickly. One was asking about providers in New Jersey. We do have a number of providers, both bariatric and plastic surgeons, that operate with New York Bariatric Group in New Jersey. So I encourage you to please look on our website or give us a call at any point if you're looking for a nearby provider. And as far as prior gastric bypasses and asking about either revision options, we do offer a number of revision options from a bariatric perspective. So if even if you're not sure whether a candidate, we always encourage you to come into the office to sit down with a provider and talk about specific options for you.
Yeah. I concur. I have offices in New York, Westchester, Fairfield, Connecticut, and Farmington, Connecticut. And I guess in terms of the quick questions, will documentation of pictures of rashes help for skin removal? Yes. Pictures are worth 1,000 words, or money in this case, insurance coverage. And I think that's how long after surgery can you wear a girdle? I have specific compression garments that I recommend for my patients, and generally it's for 6 weeks after surgery that they do compression therapy. But thank you everyone for coming. It was all excellent questions.
Yes, I wanted to thank the both of you. Thank you so much, Dr. Godshall, Dr. Paine. If anybody has any additional questions, whatever platform you're on, our contact information is associated there. So thank you again for joining us, and everybody have a great night. Thank you.
Yeah.
Take care.
Bye-bye.